My name is Chidi Iheanacho. I'm a board-certified nurse practitioner who works in cardiology at CommonSpirit Health. I chose cardiology specialty because I've been working with cardiology for about 2 years. I started with University of Utah and I loved my patients and I love working with them. I started with the heart failure patients. I worked with the transplants, the LVAD, and the amyloidosis. I love it because also it has different specialties. That's everything that you have to know about it. So it was really a good experience and I loved my patients. I love working with CommonSpirit because they're community, they work with the community. They put their patient first. And also their providers are also very, very patient-oriented. And I've seen that they really love to help their community. First of all, I like to make them feel very comfortable. And I like to make them feel like we're having a family talk. They feel very happy when I talk to them. I make them feel like as if we're not having a clinic. We're just like having a normal conversation. And they love me for that. And especially the older patients, they love me because they feel like I'm making them happy. I make them laugh. So that's the first approach to them, make them feel very comfortable and happy before I go into the whole approach, which is like finding out their history, diagnosis, like their labs, and also the social history, and also their family history and the imaging they have done. Then I will go down to the treatments that they need. And another thing about the social factor is I try to talk to them about their social history, which makes them feel very, very happy. I make them feel like I tell them the importance of either stopping the medication or stopping the smoking or having the alcohol. I tell them the importance of doing that. It's like I will try my best to make them understand what they're going through, like their diagnosis. And I also make sure their symptoms are being managed. And also I'll make sure that they get the education that will help them manage their symptoms. The favorite things to do outside work is, first of all, I love to hang out with my son. He's 10. He loves me to take him everywhere, and we go everywhere. And another thing, again, I love to hang out with my community. I do a lot of teaching when it comes to like blood pressures, the cardiac-wise. And when I travel I'm originally from Nigeria. When I travel to my country, I do a lot of teaching. And I try to make them understand that they are supposed to take their blood pressure meds as scheduled, not as needed, because they feel like when their blood pressures are normal, they don't need the blood pressure medication anymore. No, I try to make them understand that they have to take it every time because you don't know when it's going to be high to avoid stroke. So I do a lot of teaching when I go back to my country and even when I'm with my community here.